go ahead and get started. Just so that everyone knows, we have Nick Self with us, and he is going to be presenting. He does not have his camera on, but he is going to share a slide deck. So just want to let everybody know that. If you have any questions, please feel free to put those in the chat, and we will facilitate those questions throughout the session. All right, I'm gonna go ahead and turn it over to Mr. Nick Self.
All right, can everybody hear me, or at least can someone from Hope let me know that my microphone's on?
Yes, we can hear you.
Screen
Wonderful.
looks good, and we can hear you.
Awesome. Okay, hi everybody. My name's Nicholas Self. Just as a brief reminder, we are going to be discussing being a patient in modern medicine today, and the way the world works today. From my perspective, this is my own personal view, for what it's worth, right? So the agenda is going to be, I'm going to go through my disclosures. We're going to have introduction about who I am and why it's important. Then we're going to get into a little bit about the options in healthcare, your patient's bill of rights, a high level review on what von Willebrand's disease is. There's going to be a lot of stuff going on the screen. I understand that. I tried to compact it all into as few slides as possible, so that way y'all wouldn't be bored to tears. Because I know that sometimes a lot of us get in these conversations and these conferences, and it's just one slide deck after another. I've been on the receiving end of it myself. And then just kind of final thoughts and any questions that you might have. It might go fast, it might go slow, it just really depends. You guys just let me know. So we'll go ahead and get started. These are my disclosures, just as an FYI, or for everybody's information. I do work in industry at Santa Rosa Pharmacy, but the review of this presentation is not the views or expression of opinions from either Hope for Hemophilia or Santa Rosa Pharmacy. And I am, excuse me, I have a little bit of a cough going. I am not being paid for this. This is just simply, I was asked, and I wanted to go ahead and do this for you guys. So give me any feedback, the good, bad, and the ugly. If you don't like it, if you do love it, just let me know. All right. So in quick introduction about myself is I'm a 34-year-old hemophiliac and von Willebrand's patient. I have multiple bleeding disorders. And that's sort of unique to my own situation. So things that I've learned over the years may not exactly translate over to individuals that just have hemophilia or just have von Willebrand's disease. It's more of something that I've learned for my own self, right? And I want everybody to remember that none of what we talk about today, I'm not a medical professional. I'm not a pharmacist. I'm not a physician. Please always consult your own physicians, your own pharmacists, for anything in the medical realm. This is just an amalgamation of everything that I've learned over the last 34 years of life. My background is in developmental biology and embryology, as well as chemical engineering and electrical engineering. I have over 10 years in the pharmaceutical space, whether that be working at a pharmaceutical manufacturer or in specialty pharmacy, anywhere from oncology to immunology to hematology. And again, today's topic is just being a patient and what that means in today's realm. Look, there's a lot of options in healthcare that not many people are aware of, that they're not, thinking about. And a lot of what we get centered on is HTCs, our primary care provider, a private hematology team, a 340B pharmacy, and the different specialty pharmacies. But that's not all that goes into having and treating yourself, having a bleeding disorder, having a chronic disease, and treating yourself to the best of your ability. There's so many more aspects to this that you can't just let one thing slide, right? So down to your diet. If you're not eating correctly, you're going to be inflamed in the body. If you're not going and taking your medicine at the appropriate rates, and I know I'm guilty of this, so I'm sure some other people are guilty of this. We don't like to stick ourselves with needles, but if we have to, we have to. We don't tell everything to the medical provider, and the medical provider, your physician, is there to give you the best treatment that's possible. And in the same respect, if you don't tell them everything that's going on, they can't treat everything that's going on. So you might complain of a sore joint, but if it's your everyday life and the doctor doesn't know that, the doctor doesn't see that you didn't get up on Sunday morning bright and early because you had aches in your muscles, you were having gum bleeds. You have to let everybody know in your care team, and this is what I would like to call the patient center care, that this is what's going on in your life to get the best amount of care possible. The reason I put up this slide in this sort of way is options in healthcare. There are people that love their HTCs. There's people that love their private hematology teams, but there's also people that don't. We always have to look at the good and the bad, right? You might be an individual that might not just love your team. That doesn't mean that you're stuck with them. I know as a pharmacy, everyone has a choice of care. You as the individual hire the physicians on your treatment team, the pharmacists in your life, the dentists, your behavioral work, your psychologists, your social workers. You are using your health insurance to hire these people. And what I mean by that is you can fire any one of those people and go get control by hiring another individual. So just because you don't like one aspect of something doesn't mean that you're locked into that one thing. I know a long time ago, I had a doctor tell me he didn't want to switch me on my medicine because even though I was bleeding, he would rather see me bleed than switch me on my meds. I fired him right away and I went to a new treatment center. Now, to protect people's opinions and all that stuff, I'm not going to name that physician, but people who know me, and I see a couple of you in this group, is you probably already know who that treater was. But my point is that each one of you are in charge of your healthcare. The buck stops with you. So I just want everyone to understand that and really take and believe that. And the reason I want you to understand that is we have this thing called the Patient's Bill of Rights. Yes, this is about modern medicine, but part of the modern medicine is the Patient's Bill of Rights, which was first established in 1973, but has had multiple iterations throughout the years. If you don't want to take the time to read the left-hand side, which is, the 7 main points of the Bill of Rights, the too long did not read is on the right side. The healthcare industry works for the patient. It's not the other way around. You have the right to the information that is shared, from diagnoses to treatment options and costs, and understanding why you got that one lab versus another lab, or hey, I want to get a retesting. You have a right to all of that. You have a right to choose your provider. Again, the hiring and firing. You're not locked in to that one provider or that one pharmacy. Now, if you have a health insurance, sure, there might be a few health insurances out there that lock you in or do a carve out, as some of us may or may not be aware of. I know if you're in the state of Florida, you have the statewide comprehensive hemophilia program, which encompasses von Willebrand's disease. And I want everyone to understand that von Willebrand's is a separate issue than hemophilia. And way back in the day, sorry to get off topic for a second, but way back in the day, it was the National Hemophilia Foundation, Hope for Hemophilia. But we understand that these are two separate disorders. It's why Hope is doing this. They understand and they see that von Willebrand's is different than hemophilia. And I can't, applaud them enough for recognizing that fact and encouraging people to get together based upon their disorders. So why do I say all this? The reason that you need to know this Bill of Rights is, where have you ever seen this posted? And these are just more rhetorical questions for you to think about. But where have you seen this posted? When you go to your HTC, when you go to your private hematology clinic, when you go to your 340B pharmacy, when you go to your specialty pharmacy, when you look at your insurance, when you look at your employer, all of this in this Bill of Rights comes down to your healthcare and you being the main point that decides what happens in your own personal life with regards to your own health. So von Willebrand's disease, it's complicated. It's not an easy by any means. I'm sure I'll get to this later in the slide deck, but for what it's worth, it's the most common blood disorder in the United States, recognizing between 1% to 2% of the entire population. But it's the most undiagnosed bleeding disorder as well, because if you're a female, your estrogen levels will dictate how much von Willebrand's is active in your bloodstream at any one given time. If you're male or female, the stress hormones that come about will also dictate how much von Willebrand's is in your system at any given one time. And if you're trying to do a blood test and you're afraid of needles, well, guess what? That blood test is going to be skewed. So you need to know your Bill of Rights to make the right choice and understand that if you have a complaint, just because someone said that your complaint, you shouldn't worry about it, doesn't mean that that person's right. You are in charge of figuring out whether or not that complaint warrants going and getting a second opinion, a third opinion, a fourth opinion, a fifth opinion. However long it takes for you to be comfortable, that's what this Bill of Rights is there for. Okay? Von Willebrand's disease. Very complicated, as you can probably imagine and see. Oh, shoot, it just went back. It's not easy. This is the high level overview of my understanding of it again. But you have types of von Willebrand's. That's type 1, 2, and 3. In the bottom right corner, you'll see how it's genetically passed down in the autosomal dominant traits, which is type 1, 2M, 2A, and 2B. Type 2, N is in Nancy, and 3 are autosomal recessive. Well, what does that mean? It means that von Willebrand's doesn't look the same for every single von Willebrand's patient. If you look at, and not to compare anything to anybody, but if you look at a hemophiliac, you know they're a hemophiliac because they bleed, they have bleeding issues, their joints get big, and they have hemoarthropathies. But in von Willebrand's disease, the bleeding is vast and varied in the way you bleed. If you're bleeding from your nose, if you're bleeding from your gums, if you're bleeding in your muscles, you could bleed in your joints. If you are lacking the von Willebrand's factor in general, your bleeding is going, as in a type 3 that has less than 5% levels of von Willebrand's factor, those individuals are bleeding much differently than a type 1. But I remember, and there's this very cool nurse practitioner who I love to death. Her name's Amber Federizo. She did a presentation one time, and it spoke to me in one way that I could never get out of my head. But just because you're a type 1 doesn't mean you're a mild. And because you're a type 3 doesn't mean that you're severe. The severity rating of your disease state or your bleeding pattern of your disorder does not equate to type 1, 2, or 3. It equates to how you bleed and how you react. And, it might take telling a doctor 1, 2, 3, 4, 5 times, plus photos, plus recorded instances. So your friend who has type 1 and your friend who has type 2A and your friend who has type 3, none of you are going to bleed the same, but you're all going to have the same story to tell your doctor if you write it down and you have evidence of your bleeding. There's that 1 to 2% number right there. If we look at and these numbers are old, as I can already tell, because we have 336 million people now living in the United States. So 1 to 2%, if we look at the low end of that number, that's 3.3 million people being affected. And if only 75,000 to 80,000 people are diagnosed and 15,000 taking medication, do we really think that von Willebrand's disease or von Willebrands is being truly looked at in the appropriate way? In my world, in what I think is, I think that the people that are advocating themselves constantly and showing evidence are the ones that are getting the medications that they need. The ones that say, oh, you know what, that doctor was right. That bleeding's normal for my family lineage. All of my girls in my family have heavy menstrual cycles. That's normal. Well, it's not. It's nothing's normal when it's not normal. And it's okay to not be normal. One of my favorite quotes is, yeah, I'd rather be weird than normal. Now, if you'd rather have von Willebrands than normal, you know, I don't know what that's like, but it's a different experience in life. And we're so lucky to have a different experience than everyone else. But it's up to us to talk to the doctor and explain to them that this isn't normal and I need help, right? 30,000 overview for top-down looking at what a bleed looks like. You have initial or primary hemostasis, which is the first part of your clot, and you have secondary hemostasis, which is the second part of your clot. Sorry about that. The first part of your clot is where von Willebrand really plays a huge role. Now, von Willebrands is a very long protein. If you're looking at a football field in comparison to a football, to give you perspective, that football field is, you know, I can't even think of it right now. It's 100 yards, right? It's a very long field to run, but there's parts of your body, which are other proteins known as Adams TS13, that cut that football field down into different lengths. And those different lengths allow a platelet plug, because the primary goal of von Willebrands is to initiate that platelet plug and cause the initial stop of bleeding before a scab is formed. The whole part of secondary hemostasis is to really create the clot and then go on to creating the scab. Is everyone following me so far? I see a ton of questions or answers coming through. Susie.
Yes, I'm kind of watching it. People are kind of answering their own questions, but I am watching it. Lots of great chat in the chat box, I'm telling you.
Okay, awesome. Just wanted to be sure. But you know, it's a lot of people need to look at, are they truly a type 1? Are they truly a type 3? Are they truly a type 2? Based upon their bleed patterns, going to the doctor, did the right treatment get done? Because if you have a familial history of type 1 from blood work that was done on your mom or your dad from 30 years ago, that blood work's completely different today. So we really need to advocate for ourselves in how we get our treatment and how we get our diagnosis. The next two slides are just examples of different things that people may find relevant. Now, if they'll go to it, there are two types of treatment options. There's full factor replacement therapy, and there is auxiliary therapy. Let's go through, again, this is my understanding. I could be wrong. I know there are some reps in here that might be able to give you better answers. Octapharma, Grifols, CSL Behring, Takeda. I'm sorry if I butcher any of this. Please go ahead and correct it. But Willate is a 1-to-1 factor ratio of von Willebrand's factor to factor 8. It's human plasma derived. What's important about that 1-to-1 is that's what's naturally occurring in a normal individual that doesn't have a bleeding disorder. Humate P is also plasma derived. The difference there being they have more von Willebrand's factor to factor VIII at a 2.4 to 1 complex. You have alphanate, which is the inverse of humate P, where it has more factor VIII than it does von Willebrand's factor. And then you have von Vendy from Takeda, which has von Willebrand's factor. It's recombinant, but it doesn't have any factor VIII. So each one of these drugs can be used for a different varying reason for different types, for different reasons. Your doctor might find that Willate works better on a type 2B patient, whereas von Vendy might work better on a type 1 patient, or alphanate might work better on a type 3. It just depends on what your experience and your physician's experience is. So always, always, always look, if a drug isn't working for you, you have options in this world. You're not limited to just one thing if you're still bleeding. Auxiliary therapies include antifibrinolytics and desmopressin. And the reason they're auxiliary therapies is if you are lacking vitamin A or K, are you going to replace it with something that's not vitamin A or K? You simply aren't. So an antifibrinolytic is there to hold the clot in place for a longer period of time. And those drugs are Amicar or Lysteta, or otherwise known as transexamic acid. And desmopressin is there to release more von Willebrand's factor into the bloodstream. Now, desmopressin might work really well in type 1s, but in type 2s, it might not work so well, because in a type 2 patient, von Willebrand's factor is a qualitative issue. It's not a quantitative issue. So, each one of these drugs can be used for a finite situation and differences. But again, it's up to you and how it works for you. And if it doesn't work, you should look at talking to your doctor about something else. I can't stress enough that you are the end all be all in your healthcare. The healthcare industry works for you and nobody else. You don't work for them. There's so much that goes into a chronic disease that I know my slide deck and everyone else's slide decks today might not be all the answers you're looking for, but thank you for coming. And if you have any questions or if I can answer anything, I'm happy to answer.
Okay, I did see one question. Well, actually, there were a couple, but people were answering them as we went. Actually, that one was answered. Someone did ask what was a 340B, and Tara was so nice to, I guess she Googled it, and got that or whatever. Let's see.
That was the easiest way to describe it. Yes, I did. It gave a great
It was
description.
perfect.
So
It was I was like, okay. Because I was ready. I was going to ask the question, but I was like, I don't need to. Okay. Is there a test for Adam's T13 deficiency?
There is a test for Adam's TS13 issues. I don't necessarily know off the top of my head which testing they have, but what you would get if you don't have Adam's TS13 in your body is something called TTP, which is a different bleeding disorder than von Willebrand's, and it's called thrombocytopenia. TTP, thrombocytopenic purpura issues. Basically, what happens is your von Willebrand's just stays out really long, and it attaches to the walls, and it looks like petechia, or really little tiny bruises, almost as if anyone has a 2-year-old at home and you've ever given them a pen and they start to draw freckles on you, that's sort of what petechia looks like on your body.
So, stupid question, is that the same thing as the T protein or whatever?
Different.
Okay.
And I don't know much about T proteins. I won't claim to know anything. I'm sorry. I wish I had a better answer for you than that.
No, because that's what's being mentioned right now, and I'm just a little, I'm learning every day.
All right. So if anybody has any questions, that you would like to ask, you can either put them in the chat or you can unmute yourself like Tara did. And I'm sure Nick will do his best to answer if he can. And if he can't, I'm sure he'll tell you he can't answer that. Let's see. No other questions?
If there's no other questions, I guess everyone, you can get water or sugary drink before you get to your next session.
Yes. Let's see. I'm just scrolling back through to make sure I didn't miss anything. 340B.
Thank you for the
Brittany did say,
information.
I was told I couldn't have a joint bleed because I have von Willebrands after playing golf. I sent photos and infused because I know my body.
That is a perfect example of taking it, making yourself an advocate for yourself. I know a lot of von Willebrand's patients that have been told time and time again that they can't get a joint bleed. That's simply not true. Because I also know a ton of patients that are von Willebrand's patients that have had joint bleeds. It's a matter of what it takes to get in. So photos are great of the bleed. If you get a tape measure at home and you measure the differences in the circumference or the diameter of the joint as it stands when you don't have a bleed versus when you do have a bleed, that goes as more proof evidence. And if you can get into your treatment center or your private hematology team and get an ultrasound of that bleeding joint, then that is the biggest one.
Absolutely. Well, I really appreciate you being with us today, Nick. I will tell you, the biggest takeaway that I did get from your presentation is, and a lot of people were saying you can't put a square peg in a round hole and all these different things
Yeah.
because everybody's bleeds look different. And so I think, you go to the doctor and they constantly tell you, oh, well, you're mild or you're a 1 in hemophilia, it would be like mild.
Yeah.
And they're like, oh, there's no way you're bleeding. And half of the people on this session right now can attest to that's just simply not true. And so the biggest thing is to advocate for yourself. And like you said, if you're not satisfied with the answers that you got, they're working for you. Go somewhere else. So I really appreciate you reiterating that because I think people really need to hear that. Sometimes, you get that white coat syndrome and you walk in and you're like, oh, the doctor said, and they're one doctor out of how many? And, that's not law. That's their, that they're practicing medicine. So that I think is super important. So I appreciate you touching on that. And I hope that for every single person here that is fighting to get a diagnosis or fighting to get, whatever type of treatment or, whatever their fight is that it gives them courage
Yeah.
to speak up, So we really appreciate you being with us today, Nick, and your slide deck was amazing. You see on the screen there, Nick put his number, his email address. If anybody has any questions, if for some reason you don't get a chance to write that down and you remember, later on, oh, I had a question for him, send it to us here at Hope. We'll make sure that we get that question to him and he can answer that and we'll get you back an answer for your question.
Well, thank you for having me. I
Oh,
truly appreciated it all.
we really, really appreciate you. I see lots of great comments. Very important to advocate for yourself and never feel that you are alone. Thank you so much, Nick, and Susie. Thank you. Just lots of thank yous. And, great, impressive presentation. Thank you so much. So we really,
Anytime.
really appreciate you being with us today. And like Nick said, we will have a little bit of a